Hi everyone, my name's Jana Pittman and I'm one of the Australian Cervical Cancer Foundation ambassadors. Now, I was an athlete for many years, but I'm actually now a doctor, and the ACCF have asked me to put a little video together around what they're doing in this current pandemic with COVID-19 and just some advice around if you're due for a cervical screening exam. Now, firstly, we're going to say, I know there's some women out there that are currently suffering with cervical cancer, and the ACCF are right behind you. If you need some support, please get in contact with them straight away. Now, secondly, if you are worried about this COVID-19 virus, we are all worried. And that saying that you stay home for me and I'll go to work for you is the best advice that I can give you. I know it's hard to socially isolate yourself, and we're people that like to hang around with others. But right now, the thing you can do most for your family is to stay at home as most as possible. So if you have any symptoms though, and you have any recent contacts with someone who has had COVID-19 or some international travel, for example, of course, call the hotline that you can find on the website. Contact your GP for advice or come down to our specialist fever clinics at one of our major hospitals who can test you or at least tell you if you're eligible for testing. Now at home, wash your hands heaps, wash your hands heaps, wash your hands heaps, cough into your elbow, try not to hang around people too often, and that's the best thing you can do to look after your own health. Now, obviously, here we are talking about the ACCF. So some of us might be due for our cervical screening exam. In fact, I think that's me. So I know that we can't put off that screening exam, but we're also probably a little afraid to go to the GP right now. So obviously you can speak to your GP about whether they have a service in place right now to actually have your screening done if you've had a particularly positive test in the past and you need to have that followed up ASAP. Or if you do want to delay your screening, make sure you put it in your diary and have a follow-up message to make sure you don't miss it. The last thing you want to do is go a couple of months or a year or two without having that screening, only to find that you have poor results at the end and that this pandemic means more to you than if you had had the test at the time. So please look after yourself. Please look after your family. Please make sure you do continue to have your cervical screening if it is now or in a couple of months. And stay strong. We as Australia can flatten this curve if we all bind together. Lots of love from Jana. Bye.